Hello and welcome back to the EMJ GOLD podcast, brought to you by EMJ, your number one open access destination for HCPs and pharma globally. Jade, episode 4 of season 10. How are you doing?
Very good, thank you. Already here. How are you doing?
Yeah, very good, thank you. Looking forward to sharing today's conversation.
Yes, really excited to listen to this one. Who are we going to be hearing from?
So today I'm going to be sharing a chat I had with Richard Maughan, who is the Senior Director and Head of UK Policy and Public Affairs at Pfizer. So we sat down to explore Richard's path into pharma, how we can improve access in the UK healthcare system, and lots more.
Yeah, it's a really interesting interview on a topic that I know you're really interested in. Before we do get into it, though, let's learn a bit more about Richard.
Absolutely.
So, at Pfizer, like you mentioned, he works with public policymakers to improve access to breakthroughs that can actually change patients' lives.
Absolutely, such an important task. And before joining Pfizer, Richard was Head of UK Government Affairs for Eli Lilly, and he's also worked at the Confederation of British Industry, which is the UK's leading business lobbying group as well.
Yeah, very varied background. I think that's a good enough introduction, though. Shall we get into the episode?
Definitely agree. Let's do it.
So, Richard, welcome to the EMJ GOLD podcast. It's lovely to have you on today. How are you doing?
Very well, thank you, Isabel. Thank you for having me.
Well, we're really excited to have you on. We're going to be covering a range of topics today, talking about access in the UK, healthy ageing in the UK, the relationship between economic growth and healthy employees. So lots to get into. But before we do, I would love to get to know you a bit better. So, Richard, to kick things off, it would be great if you could give me a bit of background to your role at Pfizer and what actually motivated you to take up a career in the pharmaceutical industry.
Sure. So I might start with the motivation, actually. So one of my most important personal values is to prioritize health above everything. I think it is the foundation of so many things that we value in society, including prosperity. And also, health challenges are an absolutely unavoidable part of life. Everybody goes through them at some point in their life. And it's that value that drew me to life sciences in the first place. So when I joined the sector, which is around a decade ago, my mum was actually quite ill at the time, and that really increased my appreciation for medical science, right? And gave me that drive and that sense of mission in my career. And that's really important to me, feeling like I'm contributing to something much bigger than me. Pfizer's purpose is breakthroughs that change patients' lives, and that's something that is really important to me. So in my current role, I guess I get to combine that mission with my interest in politics, policy, and current affairs. That's also important because I really do believe in the ability of public policy to make positive change at a really large scale. And in my current role, I head Pfizer's UK policy team. I'm also part of our senior leadership team in the UK. That gives me the chance to work with lots of people outside of the organization, including within government, to help deliver on that purpose for patients. And I find it really interesting and really rewarding too.
Yeah, I have to say, it sounds like a very fascinating role that you're in. As you say, the intersection of the various ecosystems of industry and government is really, really interesting. And does put you at a very good vantage point to discuss the UK healthcare system, I suppose. So to kick off our discussion, what do you think the UK is doing really well here? Obviously, we have free access to healthcare, which is a big one, but where do we really shine, and where do we still have some work to do, perhaps compared to other healthcare systems around the world?
Yeah, the short answer is there are lots of things that we do really well, and there's always room for improvement. But let me just zoom out briefly, right? Because we're at this what I think is a really interesting and energizing moment. We've got the intersection of lots of different things coming together. We have people living much longer lives on average on the one hand. On the other hand, persistent inequalities in terms of life expectancy and healthy life expectancy around the country. We have, on the one hand, a wave of incredible technology coming through, right, which is heralding great promise for the health system, for patients in lots of different areas, the likes of which we've never seen before. On the other hand, of course, we understand that there are really growing pressures on healthcare systems and on the public finances, right? So I think that's the context in to the question. what really gives me optimism through all of that is the innovation, including new medicines and vaccines coming through. And I think when we look at the UK, this is a really important ambition. It's one of those areas where there probably is some room for improvement. We tend to find that access to medicines in this country is relatively restricted compared to other countries. Around 37% of medicines are fully available to patients in the UK, whereas in England rather, whereas in Germany it's more like 90%. In Italy it's more like 75%. Okay, so there's quite a big kind of difference there. It's not to be critical. I think it's important to understand the problem so that we can take action. And actually, the health secretary himself has talked about this recently. He used some quite strong language. Actually, he talked about it being almost like a guilty secret of this country that when people go to see a doctor, they think they're going to be able to get the best treatment available, but this isn't always the case. So again, that it gives us that platform for change. And when we have that clear diagnosis, we can unite around that. And if we can sort of get that issue right, we're going to be in great shape in this country for the future because we do have these real strengths. Look to the quality of the science in the UK, which is really world leading in many respects. Look at the scale of the healthcare system, the potential to partner with the healthcare system to build the real world data that's necessary to feed into the development of future innovations for the future. So if we can get all of these things pulling in the same direction, then I think there's lots to be positive about for the future.
I don't know if this is a mean question and you could probably do a whole podcast on it, but if you had to sum it up, what is the problem around our access to medicine? Why aren't we where certain other countries are?
I don't think that's a mean question at all. It's a really important question. There are many answers to that, right? And it's multifactorial. So I'm not trying to skirt around it. I think we can look at some fundamental issues, right? We're on the back of what has been a decade of disinvestment in medicines in this country. If you look at the UK, the amount that we invest in medicines in the UK, it's about 9% of overall healthcare expenditure. When you're looking at other kind of major European comparators, it's more like the mid-teens % of healthcare expenditure. And I think when you have a framework like that, inevitably it creates challenges and pressures on the whole of the medicines access process. So I think that's an important one. But within that context, there are many aspects that I think we need to look at, getting into some of the technical details around how we modernize the methods for access, and of course, how we reform and redesign services so that patients can get access to new innovations. But ultimately, as I say, we need all of these things pulling together.
Yeah, that makes total sense. Thank you so much for sharing that. And in your previous answer, you touched on people living longer. This is definitely something that's a hot topic at the moment. How can we help people age more healthily? So what do you think needs to be happening here in the UK for people to age healthier? I imagine access to medicine plays a big role in that, but are there other things at play as well?
Yeah, sure. So again, on the context, let's go a bit deeper on that. So the NHS is facing an exponential growth in demand. Okay, it's important to say that, and that's also part of the context for the previous question too. Clearly, a big reason for that is the population getting older on average. We also have a bigger population than we did at the turn of the century, about 15% bigger. We also have different kinds of health challenges, the rising kind of impact of obesity, for example, on society. And I mentioned those inequalities that continue to exist. Another factor is that we have historically underinvested in healthcare capacity in this country. I talked about medicines earlier in the context of the previous question. You can also see it in terms of the fact that we have, for example, something like a third fewer hospital beds than exists per capita in Germany. So what we're doing is pitching demand into a system which doesn't have adequate capacity. And I think that helping people to age healthier is essential for dealing with that challenge and essential for the future sustainability of the NHS. And I think, of course, I think it is important that we need a sort of theory of change for the NHS and life sciences, which is all about how we can better harness scientific innovation to prevent illness and also to treat diseases which are more prevalent in older populations, like cancer, for example. And there's many things that we can do there.
Bit of a left field one. What do you think to the industry getting involved in developing drugs that reverse some of the effects of aging? I know there's some very early science around this, but do you think that will actually become a reality, and what role could that really play?
Yeah, so I know that geroscience is a really interesting part of this debate. It's not something that I have a particular kind of expertise in, but I think as we look to the future, clearly the innovations that the scientific community looks at responds to the healthcare challenges that populations are facing, and as we know, as the population ages, those healthcare challenges really increase. So in lots of different ways. So so I understand the importance of looking into this area, and I wish the innovators and the scientists well in that endeavor.
Mm. It's a fascinating area of science that, yeah, I'm sure everyone will be keeping a close eye on. Another really big priority for the government, aside from access, is economic growth. I think we all want to see that. And I know Pfizer's been doing a bit of work around economic growth and employee well-being, and how the health of employees has a really direct correlation with economic growth. So could you maybe talk a little bit to how Pfizer's getting involved in this space and why this was something that you guys chose to focus on?
Sure. So I've been talking a lot about innovation, and obviously sort of set out the need to invest in innovation to prevent ill health and to treat diseases associated with ill health, and that's really important. And that sits in this space, which is really around partnership between my industry, the healthcare system, and wider stakeholders around that space. But I think when you zoom out and think about this broader societal challenge, and economic growth is part of that, it's clear that the NHS really cannot do that alone, and nor will it come directly from my industry, although we can play an important part. So my argument here is that we need this whole society shift to create a country that's fit for long lives, and an important area to look at is the role of employers in workforce health. It's sort of something that I think intuitively as humans we kind of get that there's this relationship between the health of an individual and the society, and that individual and that society's ability to be productive, to drive economic growth. But it's probably an area that's come to much greater prominence over the last few years, certainly in the post-pandemic period, because we have record levels of short-term absence and long-term economic inactivity due to ill health in this country. So we looked at one aspect of that. We have undertaken some research recently with the Office of Health Economics, which found that so we looked at common respiratory infections like flu, COVID-19, RSV, and that research found that these infections are costing UK businesses an estimated 44 billion pounds a year. Now that's a big number at any time, but it's an especially big number when we're talking about historically low economic growth rates, which is what we're experiencing at the minute, and over half of that impact comes from presenteeism, so people essentially working whilst unwell and not performing at their best. So I think this research is important, and there's a bit of a rallying cry here around how employers can think holistically about the health of their workforces.
So what's the next step with these kind of findings for you guys at Pfizer? Is it learnings that you just take in as an organization? Is there more you're hoping to do with kind of the UK as a whole, or?
Yeah, so as a next step, we've actually created a tool. It's a free interactive tool. It allows employers to estimate the cost of short-term respiratory infections on their own organization. So, for example, if you're like you're running a company, large mid-sized company, around 250 employees. The tool estimates a cost to your business of around £221,000 annually, over half of which comes from this issue of presenteeism. If you were a smaller company, say maybe 40 employees, the cost is something like £35,000. So that's something that, as a tool, we think will be helpful for business leaders as they think about the roles that they can play in supporting the health of their workforce. And then, of course, as you would expect, we continue to contribute to wider discussions within government in the context of what they are trying to achieve in terms of bringing more investments and growth into the life sciences sector. We are expecting to see a new plan for that, a new life science sector plan in the coming months, of course, in the context of the new NHS 10-year plan. So all of these things, I think it's important to see connected, and it's important to take concerted action against.
Yeah, really interesting. Certainly an area that we will see development in over the next couple of years, I'm sure. Talking of the next couple of years, say 5 years, I would love to think about some of the challenges that we've discussed today and ask you, what is one stubborn issue that you think will still be hanging around, and what is one that you really hope we will have cracked when it comes to access in this country?
Yeah, sure. So I'll take the second one first, if that's okay. So an access challenge I hope we'll have cracked. Well, I hope over the next 5 years we can get much better at measuring these wider impacts of medicines and vaccines on society. So by that I mean, when we decide which medicines and vaccines to recommend for use in the UK, we take into account not just their impact directly on disease, which will always be the most important thing, but we also understand how they contribute to wider national goals, like delivering a shift towards prevention, like driving economic growth. And frankly, the current methods that we use don't fully account for that. One example, which is helpful to illustrate this, is migraine, for example, costs an estimated 12 billion annually to the economy. And there are many other examples too. So I hope over the next 5 years, this is something that we can crack, because it feels really important. On your question, the other part of your question, I don't know if I'd use the word stubborn. I think maybe ever present is a better way of putting it for me. And I think there's always going to be a tension when new innovations like medicines are developed and you're trying to roll these things out within a large healthcare system. New scientific breakthroughs may move a little bit faster than the processes that we currently have, okay, and may require new policies, new processes, new ways of delivering them. There are so many examples that we can look at here. We've seen in recent years the arrival, for example, of CAR-T therapies for cancer. That's one example of where NICE and the NHS have had to begin rethinking these models and how they work with industry. Gene therapies are another good example of this. In the vaccine space, mRNA technology has been another potential example here. So I think it's important to sort of see this as a positive tension, because it suggests that as a scientific community and as a society we're advancing, and it gives us something to work together to find solutions on.
Totally. Yeah, love both of those observations. And yeah, particularly agree with that last one there you mentioned. We are nearly coming to the end of our conversation, Richard. I've thoroughly enjoyed hearing your insights. You're very knowledgeable on this topic, but I want to take it back to you now. So you touched on the reasons why you joined the industry. I kind of want to know now what's kept you here. So what is the thing that gets you out of bed every morning? What is your key motivator? And then what is something that sometimes keeps you up at night, wondering how it might be solved one day?
So this is a really easy one for me, because the answer is the same to both of those questions, right? So it's all around that, the mission and the purpose that I described right at the beginning. The need to deliver breakthroughs that change patients' lives is always going to be there, and the context in which you're delivering that is always going to be changing in terms of the science, in terms of the economic societal context, the pressures facing our public finances and healthcare systems. So in a sense, it's that mission that we all share to enable patients to benefit from these new innovations. That mission will never be fully completed. There's always going to be more work to do. And that's what we're here to do, working as a company with our partners within the healthcare system, the wider scientific and patient communities, and with wider society in this country. And again, I think it is it's another one of those things that is a positive tension and creates a platform for partnership.
Wonderfully summed up. Thank you, Richard. I suppose when it comes to access, it is really how long is a piece of string. As you say, it's always going to be going on, but really fantastic to get your insights. And thank you so much for joining me today.
Thank you, Isabel.
Really enjoyed listening to that one, Isabel. Do you have a favourite moment you can pick out for us?
I had loads of favourite moments, to be honest, Jade. But I found Richard's vision for the future of UK healthcare really compelling. It was encouraging to hear his optimism, I think, around the country's growing ability to measure the true impact of innovation, and of course that increased focus on prevention as well. I also like what he was saying about how we know how to really rapidly innovate, but sometimes, healthcare systems can't always keep up. So yeah, hopefully we see some change on that in the future too.
Yeah, science is moving very fast. I also find it really interesting to hear his thoughts on where the UK's access to medicine challenges actually come from. Clearly, it's a really multifaceted issue that won't be solved overnight, unfortunately, but there's a real appetite for change, which is really encouraging to see.
Totally. Well, unfortunately, I think that is all we have time for this week. Thank you so much to Richard for joining me on the show, and thank you to you at home for listening.
Do be sure to tune in next week for another great episode, but until then, it's bye from us.
Bye.